Good morning, everybody. Margaret Breitling here, your wellness and weight management coach, and I'm so delighted to have this morning an expert on diabetes, Siobhan D. You're very welcome, Siobhan.
Thank you so much, Margaret. Lovely to be here.
Yeah, delighted to have you. I've decided to run a number of interviews with different people, different experts in different fields, and as you know, when it comes to weight, diabetes, type 2 for me particularly, but type 1 as well, is really important in terms of managing your weight. So, Siobhan, you might just give us a little quick introduction to yourself, and then we'll kick off. I have a number of questions here which I'm dying to get you to answer. So let's get started.
Super, Margaret. I look forward to that. So I come from Clonmel, Tipperary. I trained as a nurse in Cork, and that was back in the 80s, Margaret. I then went on to join the pharmaceutical industry and worked my way to senior management for a number of years, working on some diabetes drugs. And really, it was as a result of that and realizing that in type 2, particularly in diabetes, that what's really needed is lifestyle advice, and lifestyle science for me trumped more than what any drug could offer, or at least in terms of adding it in.
Okay, great.
So I trained in that, and now I am a lifestyle coach.
Excellent. So you're giving your expertise and helping people on diabetes, which is excellent. So the first question, I suppose, and some people may not be that clear on it. So actually, what is diabetes?
Well, diabetes happens when you don't have enough of a hormone called insulin in your body. Okay. So insulin is used to regulate your blood sugars. So there literally is sugar in your blood. In the ideal or in the normal situation, you have just one teaspoon of sugar actually circulating your blood at any given time. But when you don't have enough insulin, what happens is that these blood sugars the levels climb, and your body isn't able to metabolize or to take that sugar out of your bloodstream and into your muscles and into your cells where it needs to be stored or used.
Okay, right, okay. And we hear type 1 and type 2 diabetes bandied around a lot. Can you just clarify what the difference is, please?
Sure, absolutely. So like I mentioned, lack of insulin. In type 1 and type 2, there's a huge difference in that in type 1, this tends to happen very quickly, generally speaking, over a very few short weeks, 1 to 2, 3 weeks, where you have a sudden onset of symptoms such as extreme thirst, going to the toilet a lot, perhaps blurred vision, sleepiness, sudden weight loss. So they would be the symptoms of type 1 diabetes. And effectively what's happening is that your beta cells that provide all this insulin are shutting down as a result of what's called an autoimmune disease. And you suddenly don't have enough insulin and you need it very quickly. So that's why you hear that people with type 1 diabetes need injections. And they need to inject themselves a few times a day, mostly.
Okay.
And it's really not reversible for them, for pretty much everybody. Type 2 diabetes, on the other hand, is a very slow onset. So you don't suddenly lose your insulin. It's almost like it's worn down. Your beta cells are being worn down, and what they're not producing enough insulin, insufficient amount to look after the amount of carbohydrates and sugar that's coming in. So typically type 2 diabetes is coming on over anything between 5 and 10 years. So you don't wake up one day and feel awful and think, I have to get to the doctor. It doesn't work like that. It's very slow. It's insidious. A lot of people don't know they have it until they present either with a complication or they might be in a routine screening. So that's largely the difference between type 1 and type 2.
Okay, so you're saying that it can creep up over a number of years. So what, I know you've mentioned it before, but just to emphasize it again, what do people actually need to watch out for then? Or how do they know they have it?
Okay, so you have it by a blood test, in truth. So, and you need to go to your doctor to get that blood test. So oftentimes you'll do a finger prick first, and it might be high, but an official diagnosis won't be made until you have a proper laboratory blood test, and usually it's done when you've been fasting. So that's how you get your definitive diagnosis. In terms of the risk factors, let's say, or
Yes.
the people who might be thinking, should I get myself checked out? Then I would say people who tend to carry fat around their tummy fat, abdominal fat, people who, and it's usually a combination of that plus don't exercise enough or don't move enough throughout the day. Stress has a big impact also on blood sugar, something a lot of people don't know. So your stress hormone cortisol can push blood sugar into your bloodstream. So that can, if you are somebody that has a lot of stress in your life or has had a major stress that you're still dealing with, if you like. And another thing actually that can affect your blood sugars is sleep. So usually my clients will have a combination of having that extra weight around their tummy, having a lot of stress, not doing enough exercise, and maybe not having sufficient quality sleep. They tend to be the things that mainly go into it. But I would say, to be fair, it is 90% food related.
Yeah, absolutely. Yeah, I would fully agree with you on that one. All right, okay, so and some people then are told that they have, sorry, I have the glasses on now because I'm reading some of the questions that have come in from my clients. So some of the people are told that they have pre-diabetes or insulin resistance.
Yes.
And what does that actually mean?
Okay, so pre-diabetes tends to be, there's a gap, if you like, between when your blood sugars are a little bit higher than they should be, a little bit higher than normal, but they're not high enough, if you like, they haven't reached the threshold for an official diabetes diagnosis. Okay. So that is very much saying you are at a very high risk of developing and having an official diagnosis of type 2 diabetes if you don't make changes fast. So if any of your clients are listening here and have been told they have pre-diabetes or they're at risk of diabetes, now is the ideal time to really make the changes and to reverse that. So in truth, at that stage, you'll go one direction or the other. You never just stay there. So either you will progress into type 2 diabetes or you can reverse it back to normal blood sugars. And it's really, at this stage, it's very, very doable. If you have insulin resistance, that means that actually what tends to happen, like I said earlier, it's your beta cells are wearing down because there's been too much pressure on them over all of these years in terms of a demand on these reserves because of such a high intake of carbohydrates. And so what happens is that when your body recognizes that your blood sugars are going up, it pushes out more and more insulin.
Okay.
So actually you do have a stage where your insulin levels are high, but your body is no longer able to deal with it properly. So the whole metabolism and processing, if you like, of high blood sugars and high insulin tends to be off balance, if you like, to be really, really basic about it. And you end up having high insulin before you have high blood sugars. But it all is a precursor, if you like, or this is a stage that happens before pre-diabetes and type 2 diabetes. So there's different paths or different times along this path where it's an loud alarm bell and it is time to make the changes.
Okay.
That said, I don't want anyone who's listening who may have a diagnosis, Margaret, to think, oh goodness, well, I've already been diagnosed, so there's no hope for me, because that's very much not the case. Yeah. There's very clear evidence and so much science now, and I see it myself with my own clients. You can reverse type 2 diabetes also. Which
is fantastic, as long as you do the right things, obviously.
Of course, it will only work, that way, regardless of medication. So many people are put on medication and feel that once they're on medication that their blood sugars will be normalized. And the fact is that most medication isn't enough on its own to do to get you right back into that normal zone. So it is really important that you make these lifestyle changes in tandem with medication.
Okay.
And ideally looking towards perhaps reducing your medication if possible eventually by normalizing your blood sugars.
Yeah, I think that's a really important message, Siobhan, that I know a lot of people that I know who have diabetes may not be, as aware as they should be, I suppose. Absolutely. That the lifestyle changes are such a key factor in it,
It's a panacea for, once you're on the medication, you're fine. But actually, the truth is that most people that start on the entry drug, if you like, will end up having to increase their medication over years. And one thing, because you did ask me the difference between type 1 and type 2, around 30% of people that are diagnosed with type 2 will end up having to take insulin injections. So even though it's type 2, there are quite a significant amount of people with type 2 that need to inject themselves regularly also. So that's end stage, if you like. But it is a progressive illness if you don't make the changes in your lifestyle to regress it.
Okay, right, okay. And just, I know many of my clients are women, and a number of them would have maybe had gestational diabetes. So maybe just talk a little bit around that. You know, does that mean you're going to naturally progress, etc.? You know,
it doesn't mean you're going to naturally progress, first of all. So, but it does certainly mean that you are at higher risk. So people who have a history of gestational diabetes are without doubt, and their babies, interestingly, generally speaking, if your mom has had gestational diabetes, you yourself are at a higher risk of a type 2 diabetes diagnosis at some stage in your life.
Right,
but again, like in your genes, a lot of people will say, oh, but it's in my genes, nothing I can do about it, or I got gestational through no fault of my own, nothing I can do about it. There still is plenty that you can do. Many people have the gene but never get type 2 diabetes because it is your lifestyle that actually creates expression of that gene, if you like. In other words, it turns it on or turns it off. So just because you have the gene, and there's no question that if you've had gestational diabetes, if you have a parent who's had diabetes, if you have a sibling, if people in your general circle actually have type 2 diabetes, then it's, you are at a higher risk. Obviously genetic reasons when it comes to family, but also if you're socializing a lot with people who tend to perhaps eat the wrong foods, then you're more likely, I guess, to also. So it's often found in clusters like that. Yeah,
absolutely. So it's not necessarily genetic; it's that their lifestyle is they're operating their lifestyle in the wrong way, I suppose.
Absolutely.
So, and people are mixing
and
in those
think,
circles.
Though, also important to mention that it doesn't mean, Margaret, that people are being really unhealthy all the time. It's got a really bad rap, I think, type 2 diabetes. A lot of, everyone wants to be healthy and everyone is doing their best. But what a lot of people don't realize is that it's not just about sugar. Like I mentioned sugar in your bloodstream, but that sugar comes from so many places. So for instance, white rice is, almost the same as eating sugar, or white bread, or bread in general. There's sugar in your pasta sauces, in your curry sauces, in everything. So a lot of people are really trying hard and not realizing, first of all, that they're ingesting so much sugar through no fault of their own, because reading labels, you need it's like rocket science sometimes for many people. And the other thing is, really high intakes of carbohydrates also can have an adverse effect for many people, particularly if you are in that higher range, if you have pre-diabetes or type 2 diabetes for sure. Some specialists are, will say it's just that you can't tolerate carbohydrates. Your body isn't able to deal with them. So it's, it's not entirely straightforward. And certainly I wouldn't want people to think that it's only about, if you have it, that it means you were eating wrong food all the time, because that's never the case.
Yeah, no, I know. But when you're mentioning carbohydrates, just to be specific about it, I suppose we're clarifying it, to say that it's more the starchy carbohydrates that we're talking about here, really. I mean, it's fine to eat vegetables, for example, which are also carbohydrates,
Totally.
So just to clarify that piece, because a lot of people think carbohydrates is the only thing that carbohydrates is potatoes, pasta, rice, bread, that kind of stuff. So obviously there's really good, carbohydrates as well, just to clarify that.
Very much. Absolutely. And the truth is, there are ideal ways to get carbohydrates. So like you mentioned, of course, vegetables, some of the starchy vegetables, and to be honest, there are some people, if they have very high blood sugars, they even have to watch the starchy vegetables. But, that's, if you like, in the extreme. In general, I would say to my clients, I mean, if you eat vegetables, I mean, it's just my favorite thing. It's the simplest thing in the world. And it's what so many people resist. And it's just about creating that habit to eat as many vegetables as you can, as many colors on your plate as you can,
Mm.
and to really load up on the nutrition. And the truth is that your body then won't be screaming for the unhealthy carbohydrates or the starchy carbohydrates if it's getting plenty of nutrition otherwise. So absolutely. And to be fair, there are oats, for instance. Some people will say, oh, can I not eat my porridge, or can't I a little bit of brown rice? And many people can very well tolerate the whole grain or the whole wheat carbs in small amounts.
Yeah,
So my
yeah,
rule of
absolutely.
thumb is never more than quarter of your plate.
Yeah,
And of an average size plate.
yeah.
You know,
We're singing off the same hymn sheet here, Siobhan. I'm preaching this to my clients all the time. So
very
no,
good. Well,
absolutely,
fantastic.
absolutely,
Yeah,
no, and that's great.
Definitely the way to go.
And another question that some of my clients did want to know is,
Yes.
there's been a lot of headlines about diabetes reversal in the last, very recently actually. So is it actually true that it can be reversed?
Absolutely.
And I know you kind of touched on this, but it's good to go over.
Yeah. And really what's generated all of these headlines, Margaret, are that there are more and more studies being done. So thankfully there are people around the world who are very passionate. I say people, I'm sorry, I mean scientists and indeed diabetes specialists also, who have taken this on with a passion to where they're seeing anecdotally in their own practices that they are reversing type 2 diabetes. So they're doing it now as clinical studies with many hundreds of patients, and showing incredible results. So
Fantastic.
all of the studies have shown that at least half of the people that participated, and if not more, in fact 70% of one that was done in the UK earlier, published earlier this year, and it was done in 59 GP surgeries actually, around northern England, which it is very typical, if you like. It's a specialist treatment, and these people were put through this program, and they had a 70% of people who after 2 years still had normal blood sugars, so were medication free.
Isn't that fantastic?
There's no question that it is reversible. For people who may be listening and saying, well, I can't do, these extreme diets, or I can't do they've looked at the studies. The point is that even, when we talk about reversal or regression, we really are talking about getting back to normal blood sugars, taking no medication. I'm not anti-medication. I am I'm more pro normal blood sugars, and doing everything that you can from a lifestyle perspective to have those blood sugars low. If you still need some medication, that's fine, so don't be hung up on that. I would say just focus more on really focusing on getting the blood sugars into normal range, and then seeing what you can in terms of even reducing the dose, etc. That will stand you in good stead, because the complications, and not something I like to dwell on too much, but the complications, diabetes now is a leading cause of blindness, of lower limb amputation, higher risk of cancer, of heart disease. It's linked with Alzheimer's disease. So unfortunately, high blood sugars, it really is an inflammatory state, and it leaves us open to so many other complications. So I would just, my note of caution really is just to really focus on getting those blood sugars into normal range, and doing your very best for yourself. We all want to live long and strong, and it's not that we want to, we want to of course live into old age, but it's into a healthy old age. That's an important thing. And people with diabetes need to be mindful of that, because things can be unpleasant if we don't look after ourselves.
Yeah, no, absolutely. I couldn't agree with you more, Siobhan. It's having quality of life in old age, isn't it, really?
Very much.
Absolutely. Yeah. And I suppose, maybe just to wind things up, what can people do to make sure that they don't get diabetes? It's the same thing again, I suppose.
Good question. Absolutely. So, look, good nutrition really for me is paramount. So getting back to, like I said, getting into the habit of having lots of vegetables and good nutrition. And I suppose really creating that mindset, first of all, and I should say, that's the first thing before anything. It's making the decision for yourself, about that you're promising yourself this and how you're going to do it. And I know obviously you do lots of that, Margaret, in terms of mindset work with people.
Yeah,
So,
sure.
so I would say certainly that's absolutely key and hugely important. And then, you know, to start looking at your diet, eat as many vegetables as you can. The other thing too, I would say is, you know, this kind of a myth around that we have to eat every few hours. You don't have to eat every few hours at all. So try to have just 3 meals a day, have as much fasting time as you can between your meals. You know, intermittent fasting is a big buzzword, if you like, now that a lot of people are trying. It doesn't, you know, not everyone wants to do it or can do it. But what I would say is try your best to stop the snacking and that unhealthy habit of, you know, eating in the evening. I mean, it's for all of us sitting on the couch, you know, in the evening time, having a treat is great. But if you could even cut that out and not eat between bedtime and breakfast in the morning, those small things all help towards a healthier blood sugar. Movement and exercise. So, you know, some people go out for a quick walk in the morning or do the gym and then sit for the day. They drive everywhere. They sit at their desk. Move as much as you can. Do your bout of exercise, but movement is really important also. If you are dealing with stress, then again, Margaret, I'm sure that's something that you will deal with, because obviously that comes back to the whole mindset thing. And, you know, we can't stop stress, and this is a stressful time of the year for many people, but what we can do is change how we deal with it and just be mindful. This is affecting my health. So it's like taking a step back and thinking, hang on a minute, allowing this stress to move in is going to have an adverse effect on me and my health. So how can I deal with it in a calmer way? And sleep, again, and the big thing with sleep is to try and go to bed and get up at the same time. And if you're not having good quality sleep, then, you know, to really create a good sleep hygiene. It does underpin your health. It does make a difference. And it makes a difference in terms of making healthy decisions and healthy choices. Watch the carbohydrates. We mentioned all of those earlier. So be very mindful of all of that also. And, you know, the sugars and the treats and all of that, you know, this everything in moderation. I'm not a fan of that mantra, everything in moderation, because, you know, that gives you moderate health. And if moderate health isn't good enough for most of us, we want good health. So we need to really look at what we can do, you know, in terms of nutrition and really nourishing every cell in our body at every opportunity. That will really be helpful.
Siobhan, that's been really insightful. A huge thank you to you. And I know my clients are going to get a lot from this. Just to whoever is watching, Siobhan has decided that she's going to offer my clients, you know, a special offer. So I'm going to actually let Siobhan talk about it now.
Okay, thanks, Margaret. Well, delighted really to be speaking with you and all of your clients. And so what we thought this morning would be nice to offer something a little bit extra. So I have an online program which is called Kickstart Your Type 2 Diabetes Reversal. Now this is suitable for people who are at risk, who have pre-diabetes or who have type 2 diabetes. And it is everything I've spoken about, the foods to eat. There's a module on stress, on sleep, and what have I forgotten? Exercise. And lots on all the different types of nutrition and making it easy to understand carbohydrate, fat, protein, etc. So all of that is in an online program, and lots of PDFs and downloads. People can look at that. So that normally sells for €197, but at the moment, for my own clients, if you like, I've reduced it to 97. So on my website at the moment, just for now, because I know money is tight at this time of the year for a lot of people, I've reduced it to 97. But what I want to do for your clients, I want to give you something extra. So
brilliant.
I am going to give anyone that buys that program a half an hour one-to-one session here on Zoom or on the phone or wherever people would like, just so that you get the most out of the program and help you to understand how you can get normal blood sugars or sustain normal blood sugars as best you can. So That's
Fantastic.
bit of a killer deal, I have to
Well,
say, in truth, but
thank you very much, Siobhan. I really
committed now,
appreciate
so here
that.
we go.
Yeah,
So
no,
love to speak with anyone that I can help,
yeah.
and you have the link. You'll share the link, Margaret.
I'll share the link below when I post this video, so you'll all have access to that, and you'll only get this special deal through that link. So,
Absolutely,
Siobhan, thank you so much for your time. I really
Pleasure,
appreciate it. It's been very insightful, and I know it's going to help a lot of my clients to allay their worries if they're worried that they may be at risk for type 2 diabetes, and also for those who already have it, I suppose, that it, you know, it's not a life sentence, it can be reversed.
very
So,
much, very
and
much.
that
And the thinking has
70%,
changed.
you know,
So,
really was a huge factor. So thank you so much, Siobhan, for your time.
fantastic.
Really appreciate it, and talk to you soon.
Thanks a million,
Okay.
Margaret. Lovely
Thank
to speak to
you.
you.
You too.
Bye
Bye bye.
bye.